Hi everybody and welcome to the May team brief. I'm Pete Miller, Chief Exec here at LPT, and I just want to tell you a few things that are going on at the moment. Now we're really getting into this year, the 17-18 financial year now, a month in, and we've really got to focus on what we're doing. Been some great news. Firstly, in our acute adult mental health pathway, for the first time for over a year, we've got nobody in general adult beds out of county, which is really great news from a quality perspective, a safety perspective and a financial perspective as well. And that includes psychiatric intensive care for both men and women as well. So great news, and well done to all the teams that have been working really hard on making sure that people are cared for within Leicester, Leicestershire and Rutland. Secondly, we started the CAMHS Crisis and Home Treatment Service. The children's services have been without a crisis service, and that's made it really difficult from time to time. And so it's really great that on the 1st of April we were able to open that new service, and that's also in line with other investments from the Future in Mind group, and we're looking forward to strengthening our children's mental health services over the coming year to make sure that we can see people in a timely fashion and reduce the amount of time they have to wait for treatment. Again, well done to all the teams for deploying that contract. 17-18 is also going to be a time of partnerships. The STPs have been rebranded as Sustainability and Transformation Partnerships. They're about working in partnership with others, with the acute sector, with our primary care colleagues and with social care. And we've really got to work together in integrated ways to make sure that our care pathways work for our patients and their carers and families, and for ourselves too, so that we can live within our means and make sure that care is provided at the most appropriate part of the system. There are going to be challenges though in 17-18, we're already beginning to see some of those. Some of our key challenges are workforce challenges, and we've really got to strengthen our approach, and if people have further ideas we can strengthen our approach to recruitment, to retention and to managing sickness absence. We really need to get those three things right, so we've got the right number of staff at the front line to see the patients that we need to do, and those are three really important things we need to get right. And secondly, I just wanted to focus on a couple of other workforce issues. One is about appraisals. We've done really well in the staff survey. We've improved the number of people having annual appraisals and improved the quality of those appraisals, but there's still work to be done. I want everybody to take their appraisals seriously this year. I want people to prepare for it, use the ULearn system. If you're an appraiser and you haven't had training recently, then book yourself on, get some training, because the quality of those conversations really predicts how people feel at work. And the other thing that helps people at work is feeling part of a strong, high-performing team. There's loads of evidence that the more that you feel part of a team, care is better, it's safer, people feel happier at work. But there are things that we can do to improve our own team functioning. We've got courses and training that you can go on in the trust to improve team functioning. For me, it's about three things. One, having a clear vision and purpose. Secondly, putting some time aside every now and again to work at how we're working together, not just the tasks, but how we're doing it, how we're communicating. And thirdly, understanding how you're doing, getting some feedback. What are your numbers telling you? What are people telling you about your team? So those three things, if you do those, you'll improve the functioning of your team. It's always going to be a challenging year, 17-18. I'm really looking forward to it. I want some big transformation in our services going forward so that we can be sustainable, both financially and from a quality perspective, and that we can improve the working lives of all the staff working in LPT. Finally, we've got the Celebrating Excellence Awards this year. We can celebrate the excellence of some of our carers and our staff, and I'm really looking forward to being there for an evening of celebration. Thank you for all you do.